Hello, everyone, and I hope I start to see some people right here. There you go. And hello, Ellen. Is she there? Is she there? You had to unmute. Hello, hello.
Hi.
Can you hear me pretty well?
I hear you well, thank you. Hi, Jesus.
I am super excited about this. Thank you so much. And I guess we just gonna, I usually try to, Latino, I usually try to start on time. It's not Latino time.
Okay.
But we will wait about 5 minutes.
Valerie said she was in, but I don't see her.
No, and let's see, when I see participants right here, let me just check, admit, yeah, she's here.
Okay, I just want to make sure.
A security thing to start admitting people, because there has been.
Okay, all right. Some of these people are people we send invitations to.
Yes. So Valerie is getting in. Oh my God, I'm getting so excited. Ellen, your camera is a little bit too high. I can just see you like here. Yeah, there's a little bit better.
Okay, I'll move farther back.
Otherwise, people, they're gonna start seeing you like this. Oh my God. I mean, let's see, Valerie, there she is.
Hi.
Yes. Hello. A pleasure to meet you both. I was just telling Ellen that Latino usually try to start on time, but I would say 5 minutes after is it's a good thing. I decided to go with this format that is always a little bit dangerous these days, because sometimes we got a lot of people just joining just to cause chaos. But I think it's a little bit more personal in some way to really, see hopefully other people online and things like that. But here we are. So, and I did a little bit of my homework about you ladies. Valerie, can you hear us pretty well? Let me see as to unmute for you. Yeah, there you go.
Yes, I can hear you fine. Can you hear me?
Yes.
Okay.
So just having a little bit of agua fresca right here.
Well, it's early there.
Yeah, it is
dinner time here.
Yeah, you're about 6 p.m., right? Yeah, and the advantage of also doing this, of course, is that we can share it later on with there's so many HIV groups by now, of course, and I try to always recognize and include all the different varieties of people that we have, transgender women, straight people, gay, whatever, and of course also Latinos and other people. So that will be part of the magic of doing this. So I don't want to keep talking, just want to give you a little bit of time for people to join. And just that, you both look amazing. I'm sure that by now you have done a lot of talks and interviews, but also you don't mind, of course, after we will also leave time for questions at the end, maybe the last 15 minutes. And also we will talk also about the books that now is more than one, of course. And hello, Stephen. And hopefully again, we can have just a lovely conversation. So yeah, part of the new security in some way is we can also admit people or have a different code, but here we are. Oh my God, I always get excited. It's like I have done for such a long time, and I still I'm not just get incredibly excited. I love Alessio. So anyway, how is the weather in New York? While we just take a moment to. Are you both in New York?
Yeah, I'm in Long Island. Valerie's in this
I'm
city.
in Manhattan. Yeah.
Mhm. Yeah, it's
It's
beautiful
beautiful
day.
today. Gorgeous day.
Mhm.
Well, again, we'll have a good chat. Alessio's in the center of, of the, and sometimes I like to, while we wait for more people, recognize Stephen also live in your side of the country, and he, let me ask him to unmute for a moment. You can talk for a moment, Stephen, if you want to say
thank you.
hello to.
Yeah, I'm right across the river in Fort Lee, Cliffside Park.
Hi.
Hi.
So we're gonna have people from different sides of the country, and
I'll lean at my window and wave to you.
Well, you have a beautiful sunset.
hello, Rebecca.
Yeah, I do. I was actually out in the park today. It was really nice.
Yeah, it's beautiful. Your background is gorgeous. It
Oh.
looks like you dropped it in.
That's from yesterday.
And again, we're gonna have. I'm always amazed at how many amazing advocates and activists we have in so many of these areas. Our center boy right here, Alessio, he's a student right now in San Jose State University, and for me has been always very important also to do intergenerational work, and I'm sure that's going to be one of the many things that we get in touch with. Hello, Rebecca. Hello, Kevin.
Hi, it's nice to see you.
Hello, Cambis. And Osunos, let's give it 5 more minutes, in that way we can be a little bit more comfortable. Valerie, I loved your lipstick color.
I was just saying I was texting her. I was saying how great
That's
she
funny.
was.
It's 3 of them combined. So
I knew you did
I'm going to
something
call it a
special.
proprietary color. It's called Valerie's Zoom color.
Yes. And while we do that, I also gonna include on the chat, hold on 1 second.
Oh, are we about to have a song from Kevin?
Hello, Nancy. And for security.
Oh, hi, Nancy. Hi, Nancy.
Hello, Nancy. Thank you so much for giving here, my love. I'm gonna ask her to unmute for a moment. She is also one of the administrators in between so many other kinds of advocacy that she does. She also is a wonderful administrator on the HIV London Survivors Group. So that you know, I asked her if she can also help us, just in case if we get some chaotic people, but again, some people will start join us.
I had to do this on my phone because I don't have Facebook on my laptop, and I didn't know how to get on my laptop. So I hope I'll be able to.
That's okay, Mija. I'm trying to check also the security. I guess it's sign of the times, you know, that sadly sometimes even online and Zoom work, we have to also be a little bit safe. In about 3 more minutes we'll start, but I want to tell you right now, right here in San Francisco, it has been really you know, incredible how much the violence and you know, we are really not safe in many different ways. So hopefully you guys are not experiencing that. So Kevin, do you play guitar? I can see you right there.
I thought we were about to open with a song.
Yeah, I was thinking we're gonna do that. Hello, we have Florida present. Oh my God, I'm so excited. Hello, Butch. Hello, my friend. How are you? Florida present.
In a car, no less. Huh?
Yes. So so this is super cool. I was just talking to Cambis a couple of days ago, Alessio and different people right here. We I don't know, we're lucky. But right now we have a beautiful day right here in San Francisco. Just starting to get into this. I title the same way that they titled their book, Nurses on the Inside, this conversation, what I call a heart-to-heart conversation. So I'm really super excited. Hello, Butch, you want to say hello from Florida?
Hello, and I'm not driving. I parked.
Oh, okay.
I'm about 10 minutes from where I was going, but I just said nope. I'm going to stop and pulled into the Love's truck stop here and just parked.
And
I remember with my, when we had to go online with my students, a lot of my students were driving places while they were supposed to be in class. So we always used to have to call them out and say, where are you going? You're supposed to be in school now.
Yeah, well, I'm on Central Time, so it's 5 o'clock here. So that's the time everybody's traveling.
Oh, okay, okay.
Most people think Florida's one time zone, but we're actually two, and I'm in Central Time zone.
I went to visit Butch and other advocates. How long it has been, Butch? About a year already?
It's going to be in September, the conference this
September
year.
already. Yeah, I was there last September, and they were
It was August last year when you were here.
making fun of me. Nancy, are you trying to sign in a different? Okay, yeah, whatever works for you, Nancy, that will be okay. All right, so let's just start little by little. I will ask you please to, when you are not talking, to mute your microphones. In that way we can have a better quality of conversation. And start writing your questions either on the chat or in the last 15 minutes, we will take some time to really, again, get into any questions. I hope Ellen and Valerie they will be willing to answer those questions. So anyway, it is an honor. It is an honor to have you here, Ellen and Valerie, and I'm gonna have the Kleenex ready just in case, because it is super important for me to have this conversation. I think by now we have had, even if we still, many of the HIV long-term survivors still feel we feel invisible or not acknowledged, and we're still fighting for our rights to grow older with dignity. We have had some conversations and some things, but we haven't heard much, even now that you guys have this book, we haven't heard much about what, that voice of the nurses, the caregivers, the doctors. So it is an honor to have you here, ladies. We are all the way from San Francisco to New York, and I and myself am an HIV long-term survivor of 27 years, and I welcome you to this forum. We will be sharing this conversation with our group and many other groups, and hopefully maybe they will have even more questions for you, ladies, and read the book and even get more questions. So I want to start a little bit with a timeline, and if you guys just bear with me, just like I even just imagine, closing our eyes and just think for a moment in those early 80s times, right? But before that, and I want to start really with that particular theme and start thinking about it. If you don't mind, both of you just saying a little bit about your work before anything else. So Ellen, would you mind just saying a little bit about your work and what you're doing?
Sure. Well, I've been a nurse for 45 years now, and I started back in 1978 in a regular intensive care unit, and then I went to the city after about 9 months and worked in a critical care unit there where I met Valerie. And it was probably, so that was in 1979, April, starting probably in 1980. We started to see a strange population of men come into our intensive care unit with a very odd cluster of symptoms. We did not know what it was at the time. So this is going through 1980, 81, and going forward until it was identified. And I know Val will speak more about that, but Valerie and I worked together in that critical care unit for approximately 5 or 6 years before we then traveled to other units and met up again in the mid 80s at a hospital called St. Clair's Hospital, which was on 50th Street and 9th Avenue in Manhattan. And that was New York's first designated AIDS center program. After that, we saw cropping up of multiple AIDS center programs all over Manhattan. But what I wanted to point out was that when we were in our ICU in the city at Roosevelt Hospital in 79 and 80, again, if you think back, we had no cell phones, we had no social media, we had no cameras, nothing. So we did not know that we were not the only unit that was experiencing this. We thought this cluster of new types of infections were only in our unit. We had no way of knowing that this was happening elsewhere in New York and of course elsewhere in the world. And I'll turn it to Valerie at this point.
Yeah, thank you, Ellen. Valerie.
So I also want to point out that the world was not thinking in terms of infectious diseases back in those days. We so very rarely saw infectious disease specialists that we didn't even know them by name. So when we saw some sort of infection, it was almost always what we call hospital-based or iatrogenic. So it was a pneumonia that was caused by using a lot of antibiotics, or a urinary tract infection from using a catheter. So when we saw these people come in with an overwhelming, profound infection that was killing them, it was unbelievably remarkable. So, you know, against the backdrop of many social things that were going on at the time. Remember, it was really the late 70s probably when this started, but the early 80s when things really got off. There were many political things that were happening because of the Reagan administration and the decrease in funding for public health services such as TB monitoring and other things where you might STI monitoring, they might have actually had an idea of what was going on earlier, but all of those programs their budgets had been slashed, and so there wasn't anybody at the home. There were no nurses looking for cases with TB. There was nobody looking out for people who had syphilis or gonorrhea. Probably if we go back, we would see a huge increase in the regular STIs that sometimes you see are associated with other infections. So there we were, just sort of toddling along, doing our day-to-day thing, mostly taking care of elderly people who had pneumonia or heart attacks or whatever. And then all of a sudden, all these young people started coming in, and they weren't all men. There was one woman that was pretty notable for having a completely and totally bizarre pneumonia, but she was youngish also. I mean, she was old to us. She was 40, but we were in our 20s then, and so we thought she was old. But the men were often in their 20s or 30s, and so we knew that that was not right. That should not have been happening. So for all of that, it was a complete shock.
Yeah,
and then what happened was we saw the fear of our coworkers set in. So people got afraid, and then there were consequences to that as well.
Yeah, I was going to get to that point, and you remind me of something that I didn't think about. I guess because we're getting used to now that everything is social media and information passes from one place to another one. But in those
There
days,
was
exactly,
none of that.
you were just experiencing that. So, Ellen, what was your feeling? And because I want to get to that because of what I see happening now with COVID-19. What was your feeling when you started to see these young people? That what would you say was the average amount of life that they were having?
I'm sorry, can you repeat that, Jesus? What was the?
Yeah, I was saying that, what was your feeling when you were, seeing these people arriving and maybe dying in a matter of a short time, right?
Yeah, we didn't know what to think. I mean, I remember us having conferences just as nurses. And if we go back in our book, I think the first case that we saw was actually, to us, an older gentleman, 62 years old, who was from France. And we didn't do bronchoscopies back in those days to diagnose pneumocystis. But they did on this particular patient, and the pneumonia came back pneumocystis, PCP. And it was thought then that PCP had taken on a new virulence. And I remember the nurses, we got together and we did a case conference on pneumocystis, not realizing this would later be associated with HIV infection. So after that, I actually don't recall, maybe Valerie does, whether we started performing bronchoscopies routinely. I don't believe we did that. We were just starting to treat people as if they had pneumocystis, and the drug at that time was IV Bactrim.
So you can semi-diagnose this by an X-ray, but bronchoscopy did not become state-of-the-art for several years because
Yes.
the flexible sigmoidoscope, which is the type of technology that you need to put a camera down into somebody's lungs, was sort of new at the time. And so they were doing what they call rigid bronchs, which were very disgusting for the patient and very difficult. They had put their head all the way back, and the whole thing went down as a rigid scope. So it was quite unpleasant. It was like getting choked to death. And I remember that guy because Dr. Yo did him sitting in a chair. I remember that. They had to put him in a chair. It was just a horrible thing. But in any case, the other thing that you have to remember is how little medicine knew about what was about to transpire. There were none of the tests that we use routinely today. We didn't check T cells. There was no such thing as a viral load. There was no such technology as the polymerase chain reaction, which is the basis of all of our best diagnostics. It was a very different time. Very much medicine was in its infancy as regards infectious diseases. I mean, we knew some antibiotic stuff, but believe me, in the last 40 years, things have come along so far, I can't begin to tell you.
Yeah.
It's very different now.
You don't mind, how old were you guys approximately? Without going
we were in our 20s.
I was 26. I guess I was 26 when I saw my
So that
first
made
case.
me a couple of years younger. But yes, we were in our 20s, and the people we were treating were our age and not much older.
Yeah.
And it was very frightening to be treating somebody your own age. We were, as Valerie had said earlier, we were used to treating elderly people who had myocardial infarctions, other forms of coronary artery disease. And since we were a level 1 trauma center, we were treating gunshot wounds and
so we saw young
overdoses,
people for that.
Yeah, we saw young people
not
for those
infections.
things. Yeah. We a lot of drug overdose dosages, victims of crime, etc. So we were used to that sort of thing, but we were not used to what was about to happen. 1980.
Yeah, what happened in that moment that you guys started to hear or started to find out that it was happening in different other places? what happened, was your feelings, and also what happened physically as measures of safety for you guys? What started to happen?
Well, we didn't, I mean, our supervisors at the time, our unit was set up as, we had 6 beds, ICU beds in one room, and then another room with another 6 ICU beds. And then we reserved, we had a few private rooms in the back. Actually, they were double rooms. And when we started seeing so many, usually young men coming in, we started to isolate them in the back rooms. And then out came the PPE. And if I tell you how much PPE, it was almost like if one mask was good, 2 was better. If one gown was good, 2 was better. Booties, hats, double gloves, triple gloves, people, and we, again, not knowing at this point that we were dealing with a bloodborne infection.
Yeah.
We had young women also working with us who had children, who were pregnant. And we chose at that point, since we didn't know, they were concerned. So Valery and I often volunteered to go into the back to take care of these people because there was such fear.
Yeah.
And then, of course, came the conversation. And I will admit to you all at this time that I did not recognize that these men were gay. I did not know. That was my first caring for people that identified as gay, and they did not identify. I just sort of figured it out, and I was like, wait a minute, what, there was this common theme, and me being 22 years old, I said, what is this? And then, of course, started all the rumors, all of the gossip, all of how we came up with GRID, the gay-related immune deficiency. There were a lot of physicians that were very opinionated about it. And again, thinking or saying people were deserving of this. So we experienced kind of that rollout of like, oh my God, what is going on here? And why is it affecting gay men? And I know Valery and I, we did talk about 2 women that we had, but we didn't identify with them at the time. However, as we were taking care of these cases, and I just want to preface this by saying that Valery and I worked the same schedule because we got to be friendly. So we were always on at the same time. So we were always conversing about these cases. And this one woman that we did have, we do mention her in the book, it turns out that she was a prostitute. She was a sex worker. So, and still, I don't think we put it quite together at that moment. Like, oh, okay, there is another person that is getting this same type of infection. Yeah. Things were just happening so quickly that we did not have time to think and put things together. We were just throwing out stuff.
Yeah.
Well, I mean,
other,
it happened
right?
quickly on one hand, and on the other hand,
Right.
it sort of unfolded more slowly than I would have liked, because there were a lot of theories that maybe some of the drugs that people used when they were having sex, like poppers, were responsible. There was a lot of stuff thrown out there that was totally useless. It was just speculation.
Yeah.
It really was quite a long time before they figured out it was a blood-borne illness and blood or body fluid-borne illness. And so even though in my heart I had figured that out already because of how close, I don't think you understand how intimate a nurse is with a patient in the ICU. I mean, we're right down there, sharing their air, sharing their whatever. We used to draw blood without gloves. We used to clean up everything. We used to bathe people without gloves. I mean, we were really in there. And if there had been any kind of casual way that a person could transmit it, then we all would have been infected. So, so in my heart, I felt like there was something missing in this explanation of how one acquires this illness. And ultimately they did find out. So, but they found out pretty early, and people were still afraid to go in the room. They were afraid to deal with blood, as though we hadn't been dealing with hepatitis all our lives, or other bloodborne illnesses that that people who practice medicine have to deal with.
Yeah, and I thank you for real for keep going, because many maybe didn't keep going, and I do know, I guess, the close relationship that you guys had with the patient, because I'm one of the many of the HIV long-term survivors or survivors of other health issues that sometimes we are in that bed and we're not able to move at all, and you even guys have to clean up our poop and do everything, guys, you can, but you kept going, and for that I thank you. In the group that we have, we have some people that they're not HIV positive, but they experience everything that was happening. They lost lovers, friends, etc. And I'm sure you guys, maybe we became closer to some of these patients that their families were not there for them, and
Yes.
and you guys might have stories and everything, but you guys for me also are HIV long-term survivors in that sense. I want to recognize also your role as women, and Valerie, if you don't mind, also I did my homework. I know that you had been 40 years together with your partner, Mary.
Yes, just 2 days ago, we celebrated our 40th anniversary. So my
Right.
Mary.
40 years of the
Yeah.
first cases of HIV AIDS, and you've been with Mary also 40
All
years.
that time, 1982.
Well, that's how we got our blood work done so quickly.
Mary
Only
worked in
I
the
didn't know.
lab, so
I didn't know it at the time.
yes. I didn't come out to Ellen until many years, actually after she was married, because I didn't want to frighten her.
So Ellen, you thought you didn't know anybody gay or lesbian.
Nope, I did not. Just a funny story, because
Yeah.
Val and I went back to school together, so we studied together like every weekend we weren't working. We were usually in my apartment, and we, of course, we had to go to the library, and we took out books, and they were all littered across my living room. And I knew Valerie lived in a studio in Manhattan. She lived in a studio, and Mary was living there. And I kept saying, well, what happens if you want to bring a date back to your apartment? And Valerie's going, no, we just don't do that. Like we just don't. And I just, and I think at some point she said, would you just drop it?
She's so nosy. It's really hard to be in the closet with her.
I just want to recognize again 40 years of the first cases of HIV/AIDS, and you've been together with your partner 40 years as well. So congratulations, but also
Thank
once
you.
again recognizing the role of women and the LGBTQ community as well in many of these things. And of course, we have to recognize that now, of course, we have all kinds of people with HIV/AIDS, and that originally was called just the gay disease, and now we have all kinds of communities still happening with that. So Ellen, you were hired to work in the first AIDS, how you call it,
Designated AIDS Center.
Yes, that's what they were called in New York, designated AIDS centers. And, there was a big rush, like after 86, going probably close to 1990, when really every hospital in Manhattan wanted to open up a designated AIDS center. And that's because there was no DRG for AIDS, diagnostic related group, so that insurances could be billed, whatever. And that was a huge impetus back then in 1990. So Valerie and I stayed at St. Clair's Hospital, the first one, and we put together what is now called case management team. I mean, there was nothing. I mean, we had to start from scratch and say, okay, well, we need a social worker, we need a dietitian, we need a psychologist, we need a bunch of doctors.
We need a dentist.
Yeah, we need a dentist. We need a neurologist. I mean, and back in 1985, which is when I started at St. Clair's, Valerie came a little bit later. We didn't have any of that. I mean, we had like one doctor that would come onto those units. The other doctors that were taking care of patients elsewhere in the hospital would bypass the units. They were called the Spellman Center. It was the Spellman Center. They would bypass. They would actually go up a flight of stairs, across and down to go to where they wanted to go, rather than cross through our units. We opened up a inmate facility there, and in the 80s, and then we were recruited to open up another designated center at another hospital in Manhattan in 1990, where we both went. And then we stayed there approximately 10 plus years. I was there a little bit longer, but so I would say that in 1990, really every hospital in Manhattan was opening up a center.
Okay.
And fortunately, where we were, we had a lot of contributors to our AIDS program. So we could afford to celebrate every holiday, decorate. We had a lot of volunteers. We could do a lot for the patients that we could not do it at St. Clair's. I mean, St. Clair's was a rundown dump of a place to work.
So just to sort of put it geographically and
Yes.
in terms of how New York is laid out, certainly in those days, although I think all bets are off now, but in those days, the West Side was considered to be the poor side of town, and the East Side was the very shishi part of town. Lenox Hill was on the Upper East Side and was very much a community hospital of the wealthy and privileged. And for them to open an AIDS center program was quite controversial. Whereas at St. Clair's, it was kind of surprising that, well, I don't know what to say about St. Clair's, except I'm really glad they're closed. Because that was possibly not only the poorest hospital, but the poorest run hospital I ever worked at. But at
Didn't
least
they-
they had their heart in the right place.
Didn't they have a methadone clinic there also?
Oh, they had a methadone clinic, yeah, yes,
I remember that.
absolutely. Yeah.
Yes, and I think there we opened up the first HIV testing clinics
Okay.
for, and we had the term called the worried well, which was a term we used back then when people just decided because they had a one-night stand, they should come in and get an HIV test. We had that, and as I said, we had the inmate unit. That in itself is just an entirely different animal, being a correctional facility and a hospital, because which came first, and we do just talk about that a little bit in our book too.
Sure.
Can
I ask you,
please?
besides the hospital, also, you had life in a personal way affect you? I know that, Helen, you say that you didn't know initially anybody gay, but what about you, Valerie? Did you knew, or did you heard in the community or people that you knew?
Oh, definitely, definitely.
One of the
Many of my friends were on the first AZT studies, and people knew what I did and they talked to me about it. So my gay friends who were HIV positive. So it was, in many ways, it was a very, very difficult time, both socially and professionally for me. So
one of the saddest images that I saw in a documentary that they did here in San Francisco, it was just the images of the patients of the hospital, of how many people were dying every day. And for me, just that simple image of the patients, just of people disappearing, is just one of the saddest things that I can think of. I want to go to now to something that I'm sure by now you also guys know HIV long-term survivors.
Oh, yeah. Up until very recently, I was still working in HIV. I just retired basically last week.
So I want to connect all this story that happened also with what's going on right now, and with the nurses and the things happening. I know that in these days, in those days in history, is interesting because when they started to put the 6 feet of distance on COVID-19 from every person, I always tell people that that distance was there on the 80s or the 90s, but it was stigma and discrimination. Of course, in the moment that they started to know that you were gay or there was a little bit of suspicion or something, then the distance was there. How did you guys, what can you say about when those people were in their beds again, and in the case of many gay people, not having their families there and being isolated, how did you, what were your coping skills to deal with emotionally with these people that you knew maybe they will die in a couple of days or in a few days? How did you deal with that? How do you think you manage?
Well, I can speak to when I was recruited to be the head nurse or the coordinator of the AIDS Center program at Lenox Hill. We started with no nurses. I was allowed to recruit and hire whomever I wanted.
Wow.
And, nowadays the onboarding process is so lengthy for any type of position. I'll first say that at St. Clair's, where I started off as a staff nurse, then became the educator, and then became the coordinator, anybody that walked in the door, if you weren't afraid, you had a job. That was it. Can you answer phones? We'll teach you how to be a nursing assistant, an orderly. There was no certifications, you can be a volunteer, you can talk to people. When I went to Lenox Hill, I brought with me many nurses from St. Clair's. They had the experience and they had the passion and empathy. I did fire actually probably 2 nurses during the course of when we began the Lenox Hill program, because I found out that they were there for their own agenda.
Okay.
And so as far as I know I digress because there's so much to talk about, but as far as the patients who had no family, I mean, we became their family.
Yeah.
The nurses that I hired, most of them were in a risk group themselves.
Wow.
They were gay men, gay women, former drug users,
Yeah.
and they felt a calling to do something.
Yeah.
And those are the people that I wanted, because we could train anybody to take care of the patient and to know the side effects of the medications we were given and how to monitor a patient. But the passion and the empathy cannot be taught. It was either there or it wasn't there.
Yeah.
And the same held true with volunteers, because as I said earlier, Lenox Hill, we had a lot of volunteers, and we had a lot of volunteers there on their own agenda.
Yeah.
So we had to get rid of a bunch of those too, because they were there, kind of really just satisfying their own curiosity, if you will.
Mm.
And that was of great dismay to me. But when we had patients that had no family, we became their family. We sat there, nurses that I hired came in on their day off to sit with somebody that was passing. I can't tell you how many memorial services and funerals we went to of our patients. It's different nowadays. Val and I always talk about it, and I say I've taken care of thousands and thousands of patients in my long history as a nurse, and I remember almost none of them except for my days back taking care of people with HIV and AIDS.
Ellen, just to jump in, one thing I've never heard before, I'm curious what you mean by this. Maybe it was something going on back in the early days that isn't happening now. What do you mean when people were following their own agenda to the point where you had to get rid of them? Like, what on earth were they following that was so awful?
Well, I'll tell you, there were a few women that for some reason they wanted to be around gay men. They wanted to be in the inner circle. They wanted to know about them, what they did. So, commonly they're referred to as fag hags. that fruit flies, if you will, but
Still use.
they,
Well, I mean, there's a whole book about
right,
trying to make fag hag not such a terrible
Right.
term. But in this case, I
right,
think that they were trying to satisfy their own, as Ellen would say, agenda, and not trying to meet the needs of the patient.
right,
And that's
right.
what we were focused on, was trying to meet the needs of the patient and not trying to satisfy your curiosity about
right.
uh,
I mean, we had
death and
trans,
dying or whatever.
right, we had transgender patients, pre-op transsexual patients, sex worker patients, and there were people there that wanted just to like listen into rounds. They just wanted to be little flies on the wall and hear, all the dirty stuff. That's what I mean by their own agenda. They just wanted to know, and they had no business. It was not their business.
Well, this is not the place for them to learn. This, if they wanted to learn about it, that's one thing, but this was not the place for them to learn.
The objective was different, exactly. I wanted to talk to you guys again, not just because of the role of nurses, but about to also to know how as human beings, how do you really, of course you were doing a job, and I know that of course the work of many doctors and nurses is you had to desensitize yourself in some way. But question, when COVID-19 appeared now a few years back, did you guys experience any triggers, or what did you think is like once again, or what went through your mind?
Well, I think we ended our book Nurses on the Inside with, what will happen with the next epidemic or pandemic. I mean, we left it open, never realizing that there would be one.
Wow.
But just go ahead, Val. Go ahead.
Well, I would say that I probably not too many of you paid much attention to the first SARS outbreak in China well over 10 years before the current outbreak. But that, I was working in infectious diseases. It was something we rounded about endlessly. We discussed it. I read papers on it. It was very much a concern of mine because I knew it could happen again. Now, it just so happens that the political climate of China was such at the time that they could close those borders. And that's the only reason that we didn't have the outcome then that we have now, because air traffic was completely curtailed. People were not allowed to come in. They were not allowed to go out. And yet I knew that an airborne infection, if it were able to get started, would be a complete game changer. And I've sort of been thinking about this for a long time. I mentioned it at the end of the book that it was something that concerned me, and everybody who works in ID has been worrying about this for years. Yeah. So the fact that it happened and that it got so out of control is something that doesn't entirely surprise me. That didn't mean that I wasn't totally shocked by it. I was totally shocked and dismayed and upset.
Yeah.
But
I want to leave a space for questions, and time is flying like crazy. So what I want to do right now is I want to throw to you just certain words, and you just tell me whatever comes to your mind about this issue. Either of you, or any of the two of you, or both of you. AIDS denialist.
Complete insanity. I don't even want to go there.
Are you insane? You may as well.
I've come across this a lot, yeah. So no.
I'm sure Valerie more than myself, but we have the Holocaust deniers. Yeah. So it's, to me, it's the same thing. We lived it. We lived it. We knew it. We knew it was there.
Right. I'm sorry that I cannot. If people want to deny science, then maybe they should stop going to their doctors or taking antibiotics or getting dental work done, and let's see how that turns out. That's all I got to say about that.
Coping skills.
Crying and having somebody to cry to.
Well, I would say early on when it was our 20s, I think it was alcohol. But
That's
know,
true. That's very
we
true.
did often go out
Tell us
after
the real
work.
stories. Come on, Ellen.
We cleared out more restaurants than I could tell you.
Mhm. Yeah, especially,
guess
you know,
you
in
did
in those days, we walked into a bar in our scrubs and the place emptied.
Yeah.
No, it was when we started talking. That's when the place
Yeah,
emptied.
But yeah, I'm wondering exactly how you guys manage, and that's an answer. I think now we need a book about everything that happened right there on those gatherings, you know, the nurses.
You'll never hear it from me.
No, it's enough. Okay, and somebody here in our audience maybe is gonna have also a lot to say later in the few minutes that we're gonna have. But what can you tell us about AIDS, the cure?
Let me see. The cure. I always think that we're this close. At the moment, we're still trying to find the right monoclonal antibodies. We're still trying to figure out how to use the RNA vaccine technology. You know, I've many times said 10 years. I don't want to make a date prediction. I know the cure is there. It's going to be like, I hate to say this because it seems so random and stupid, but it's going to be almost like penicillin. Somebody's going to accidentally find the right formula. I mean, our team at Cornell is working on it, and multiple other sites are working on it. You have really good minds working on this problem, and they're definitely vested and interested in it. The whole AIDS clinical trial group is interested in it. The NIH is interested in it. So there are a lot of great people working on it all the time now. So be of good cheer because it will happen.
AIDS industry.
AIDS industry.
Well, that,
I mean,
mean-
it's similar, but you know, I think it's taken on different meaning. You know, again, with social media, all the LGBT groups now, that, you know, everything is taken on a life of its own. I know a lot of people are philanthropists now and are raising money not only for United States but other countries. So I think we have a huge industry. I mean, we network with people all the time that reach us because of our book, that ask us to speak and endorse whatever it is they're doing to raise money. We're involved with an organization called Until There's a Cure, where this woman is raising money to cure AIDS in Africa, and she's doing that by selling jewelry.
Yeah.
So, you know,
But
we donated
sort of-
our books for her organization as well. So, you know, everything we do is to, you know, the book's proceeds, however small they are, and they are small, we are not by any means rich and famous, our proceeds are all donated.
So the other thing that I think of course, is people talk about the cost of HIV medicines, which are mind-boggling. They're mind-boggling. And I know that the research and development, because I was part of the research and development, so I know that the costs of that are very high. But I do worry about the costs of those drugs and other drugs. I mean, not only drugs to treat HIV, but cardiac drugs are getting crazy. Even blood thinners for people who've had a DVT are getting nuts. Antibiotics are ridiculous. I think that there has to come a time when the pharmaceutical industry is brought to bear. I think the most clear cut and egregious abuse of this was the man who bought the EpiPen and then raised the price by 100 times. And then now I believe he's spending some time in jail for doing that. But in fact, this is really a big, it's a systemic problem in the United States and actually worldwide, because all these drugs are made worldwide in Switzerland and England and France. So the United States isn't the only player here. I think we're that goes along with the increasing cost of healthcare in general. It's just something we have to face and do something about.
One last word, and I was telling maybe a couple of people here already, or I told someone, HIV/AIDS is the only disease that when you go to a dating website, they ask you, will you date an HIV positive person? What can you say about the stigma and discrimination?
Oh,
Oh,
God.
boy.
You know, it's bad. I know it's bad, but it's so much better than it was. I mean, it used to be you could lose your job, lose your apartment, lose your family would abandon you. You could lose everything by being found out to be HIV positive. And I think things are better now. I think that the movement towards PrEP, another thing that I've looked into rather extensively, I was part of the HPT, both the HPTN PrEP programs. I think that people who are negative have a fear of becoming positive, which is a real fear. And so that's what PrEP is to, is trying to address, allowing people to have the regular intimacy without fear of becoming infected. The other thing, of course, is undetectable means uninfectious. And so that was something that we found during the PrEP studies, and that was sort of an accidental happy finding. And so when people who are HIV positive are well treated and undetectable, then they cannot transmit the disease. Now, is it 100%? It's not 100%, but it's as close as you're going to get. And many population studies back this up.
I want to just throw one more word for fun, and we have a question right here on the chat, and I want to open it to the rest. Sex.
Yes, please.
Yeah.
I don't know where that came from. Sorry. My husband is listening in another room.
Yeah.
The good thing I just had a hip replacement. I can't do it.
So, okay, so somebody's asking again, when did you start writing the book, and what was the process like?
Go ahead, Ellen.
Okay. Well, I always say this, and I know Nancy because I've corresponded with Nancy over the years now on social media.
Good.
The process was that we wrote the book almost on a dare. A elementary school friend of mine that I hadn't seen in 50 years, we got together with a bunch of us and said, well, what have you been up to? And when they heard that I had worked during the HIV epidemic, they said, write a book. And I said, no, can't write a book. I'm not an author. I wouldn't even know how to begin. And then a couple months later, I just, all these memories started flooding back. I think that I had pushed them out of the way, but, actual patients, their names, their birthdays, how old they were, their date that they passed. I mean, I remembered everything. And I sat down at my computer and I started just typing away the story of David, the story of Gary, the story of, Danny. I typed this out and I kept saying to myself, where's this going? And then I said, wait a minute. And I called up Valerie and I said, Valerie, we're writing a book. And she said, okay, about what? I said, about our time working with HIV/AIDS. And she said, okay. And she started doing the same thing, flooding memories of patients that she remembered that I perhaps didn't. And then when she sparked my memory, I said, oh my God, of course I remember him, and I remember her, and I remember her. And then we just started putting together a series of stories, which began as just a memoir. And we couldn't get it published because we were turned down by multiple agents because it was not commercial enough. And that led us to an indie publisher who slightly novelized the book, albeit we circled back around and redid it our way. So the book is technically considered a novel, but it really is a personal memoir of Valerie and myself. And that's how we wrote it. Was I would write, I would send everything I wrote to Valerie, and she would comment and send it back, and we would go back and forth like this until we had 242 pages.
Is it an audible? So audible? Audible. I have an accent. Audible.
No,
It
it's
is
not
not an
audible yet. No.
It's not in an audiobook.
Okay, but somebody I guess can read it for the rest. So I want to start opening again, if you don't mind, just some kind of order. If anybody has a question, you can either put your hand up or write it on the chat. But let's open it. I think we have our first client, Alessio, and thank you for being here, Alessio. Is you have the space.
Okay, so hello everyone. I'm a journalist student, so I'm pretty interested in HIV story because I'm covering this issue, this topic, because I just seen that the White House, since I'm an investigative journalist, so I personally dig very deep. I basically found that the White House came out with a plan, with a 3 years plan that starts in 2022. So it started 2 months ago, and it's gonna finish in 2025. So a 3 years plan, and the goal is to eliminate HIV and AIDS from the United States. However, if I look at the data, I find out that actually HIV, after an impressive decrease in the last 4 years, it started to slightly rising up. So my question, in your opinion, always, it's a personal opinion. So I would like to ask, do you think that actually the White House, the American government, seen something about HIV, which maybe is coming back, so it's time to get him attention again? Or do you think it is just a normal, how can I say, a normal rhythm of the spread? Is it something normal, or is it the United States that wants to focus the attention because something is actually happening, in your opinion?
Actually, the talks about ending AIDS has been in the works for a long time. Part of it was the funding to the PrEP studies, and then to the treatment of people who were positive to make sure they were undetectable as another form of PrEP. PrEP obviously for people who are HIV negative, and treatment as PrEP for people who are positive. I think that you saw a lot of weird things in the last 2 years, probably because people didn't leave their houses, and so they were having a lot more sex, and so maybe that's true. I actually did not, for the last couple of years, look at the incidence rates of syphilis, which syphilis is one of those indicator diseases that can give you a clue what's going to happen, and to a lesser degree, hepatitis C. Because, whenever there is a big party in New York, then about 2 months later, you're going to get a huge increase in case rates of Hep C. And then later on, you might see case rates rise for HIV as well. But I'm going to blame it on COVID, because we did see a really nice trend down of new cases. So other than maybe people getting discouraged and not taking their meds or not having access to PrEP because they didn't want to leave their house, I'm not really sure what other way to explain that trend in the US.
But Valerie and Ellen, I don't know if that happens also in the New York area, but when COVID started to show up, before that, we already had a huge increase, a huge epidemic of syphilis. And then, of course, what happened is with COVID-19, all the clinics that they were testing for HIV, AIDS, and STDs, they closed down. And almost it was impossible to get an STD test or HIV test.
Right. Well, the Department of Health actually did certainly slow down, and close down, so that when they reopened, there was a huge increase. But that didn't mean people weren't showing up with acute HIV in emergency rooms. It's just that for the most part in New York, there was a time when you could clearly have syphilis and nobody was going to see you, because they were so overwhelmed with COVID. Mm-hmm. There's no way to tell you how the ERs looked back in those months. So there was nobody getting tested for nothing back then.
Mm-hmm. Anybody else has any curiosity or question, guys? Mr. Steven.
Thank you. Well, ladies, thank you very much for all the profession, and Valerie, happy retirement. I guess so it sounds like you all did hands-on learning. Did you eventually go into teaching at all? Did you do any teaching within the field?
That's what Ellen does.
Oh, okay. So that there's that. And then so basically would you ever think that we have long-term survivors now? Did you ever think that at any point? Did you, right?
No,
And so
I honestly, I have found out through our contacts on social media when we were promoting the book, and when we did book talks, and back then before COVID, we could do book signings at the Gay and Lesbian Center in the city and GMHC. We would go there. So we were out there in the midst of it all, promoting the book and seeing long-term survivors. And we did a couple of lectures with a woman, Elena Fitch, who also wrote a wonderful book about HIV called Waking in Havana, about AIDS in Cuba. And we did a joint lecture with her. And there were so many long-term survivors that came to that lecture as well. I mean, if you look back at our careers, well, Valerie certainly, since she went into research, when HIV went to outpatient, I went back to critical care. So I was taking care of critical care patients, where HIV was just a secondary diagnosis. And the only way I knew is because I could see the med regimen they were on, but they weren't in the hospital for that at all. It's only through our work through the book and our talking about the book that we have learned of more and more and more long-term survivors on social media, the digital living quilt, I see somebody followed the AIDS Memorial, but through that we found also survivors.
Well, I also want to say that I would say 90% of my practice was long-term survivors, because those are the people who ponied up their time, their effort, their blood to do the research for the drugs that we have now. So I want to thank all long-term survivors who committed themselves to do the research, perform the research by allowing us to look at their bodies and try the meds on them. And also for all the mentoring that you've done for people who either were afraid of getting HIV or had gotten HIV and didn't know how to deal with it. Yeah. You know, the long-term survivors, I've referred many of my newly infected patients to some of my older patients, my long-term survivor patients, because they've walked the walk and they know exactly what's going on. So thank you to all of you for doing that.
Just a quick follow-up. I just wanted to say, so all of that's great and I love it. And I'm at Cal and Lord and see if we can get you over there. So if we get you to talk. So now you're seeing long-term survivors are actually living. There are now 6 states that have laws in their books about taking care of them, you know, that cultural competency about, you know, how you treat them. And we have a whole slew of new nurses coming in and, you know, all about, you know, how it's flipped, how they are going to be taking care of the long-term survivors, because that's I'm not hospitalized yet, and you know, and so I'm happy to say that I'm in New Jersey, and New Jersey was one of the recent states to pass the laws, and so I'm hopefully when I do get to go to the hospital, I'm gonna be, you know, I'm gonna have, you know, yeah. Anyway, you get it.
A competent nurse. We all want a competent nurse. Yes. Ellen is helping to make sure that happens because she's training the young ones now.
Right. Thank you very much.
Yeah, actually, one of my students is actually on. Her name is there, Faye. She's one of my former students that is now a nurse.
Is she present? Is anything that Faye would like to say?
Yes, Faye, are you there?
I'm gonna ask her to.
I'm calling her out.
I'm here.
Hello, Faye.
Yes. So Faye is a new nurse of a year plus.
Yes.
But Floor is yours, honey.
Is there something that you would like to add to the picture of these nurses on the inside, beautiful Valerie and Ellen?
I just want to say that Miss Matzer, I was introduced to Ellen as Miss Matzer because she was one of our clinical instructors, and somebody in the first few days of school told me that she has a book, and I ordered it and I read it, and from that day on, I couldn't speak to her. I got so nervous that she would ask questions in class and I would look down hoping she wouldn't answer. She wouldn't call on me, because like Valerie and Ellen became like, you know, these nursing rock stars in my book. And I was starstruck for a while. I was intimidated. But no, they are wonderful. And you know, I love the book, and I love hearing them talk about the book, because it seems like every time they talk about it, just new information comes out. So you know, I love them, and I love their work, and I love their new book too. So thank you for doing this.
Thank you, Faye. We have another question on the chat, and we have a few more minutes. Have you had, and thank you, Butch, have you had any feedback, either positive or negative, from families who see their sons or daughters in your book?
Actually,
Ellen
no.
has a good story about that. Yeah.
Well, actually, most of the families of the patients in our book we are no longer in touch. A lot of the parents have since passed. I am in touch with the brother of one of the patients in our book, Danny, and we are in touch to this day. And he is doing his own journaling, has written a play. He created an entire website for his brother, whose name is David Serco, and it's the David Serco Project. David was one of the founding members of ACT UP back in the 80s. And his brother, Peter, is making sure that David's memory stays alive with that. So that is the only one. Other than that, I have lost touch with most people, just because it's been so long.
Yeah, thank you, guys. Again, as soon as you guys come out with something, other questions, I want to ask you, what kind of message will you send to all the nurses? Because we seem like we're losing a lot of nurses now with COVID-19. Many are leaving their jobs. They don't know how to deal with the pandemic. And that's what I guess I kept asking, how did you do it? What kind of message would you send to the nurses or anyone that started to think about getting into nursing in these difficult times?
I think that nursing will remain a worthy profession, and I would hesitate to have anybody shy away from nursing because of a potential for a pandemic. I mean, we prepare for this stuff. We've been involved in this for so many decades, and I'm still there. I can't retire yet, and I still want to train the next generation and the next generation of nurses so that they don't have any fear. They know the science, they know what to do, and they know how to take care of people, and they know how to do it correctly.
And but I also want to say that we need to look to our leaders in the hospitals to make sure that they provide an adequate safe work environment for people. I know a lot of nurses felt in many ways abandoned during this pandemic. I don't think that in some cases it was intentional, but in some cases we felt that people did not always do the right thing. So we need to hold our leaders accountable for that kind of thing. The dearth of PPE in the early parts of the pandemic was shocking and unforgivable. It was very confusing to the nurses who were working at the bedside, and I always think that the whole purpose of either being an administrator or a head nurse is to support the staff nurse who is working with the patient, because that is the person who needs the most help. That's the person who has to be there and can't leave the unit, can't go searching for stuff. So it's really the hospital's responsibility to make sure that they have enough supplies and equipment to deal with the
Mhm.
problems at hand.
Yeah, somebody just put in the chat, what is the new book? And I just wrote the title. Of course, it was only fitting that we write about this COVID pandemic, which is why we wrote Beyond the Mask, the first wave, and it covers the first 5 months of the COVID pandemic, beginning before we knew what it was we were dealing with. So there are parallels between our first book and our second book, only this one is more novelized. But since Valerie and I were not on the front lines during the COVID pandemic, I was in the nursing homes and I was teaching. We interviewed nurses and other healthcare workers across the country, those that would come forward. The reason the book is a novel and is considered medical fiction is because in early 2020, nobody would identify themselves nor their place of employment for fear of being fired.
Yeah.
And we saw that at the very beginning of the pandemic when nurses across the country were in fact being fired for wanting scrubs, wanting more PPE, etc. And then that prompted me to think, well, somebody has to memorialize the beginning of this as well, because just as we know, years down the line, we will have forgotten this as well. Just as many people who weren't even born yet at the beginning of the HIV/AIDS epidemic will not have been born at the beginning of this. So somebody has to memorialize it. And I thought, well, who better to do that than myself and Valerie? So we did.
And I want to tell you, ladies, also, for anyone that is interested, I will put all the information or where to find the books on the different social media platforms and under different things. In that way, people can get it, because one of the things that they are doing, if I'm not wrong, part of the money or something like that is for scholarships for new nurses, correct?
That's where Nurses on the Inside, we sponsor a scholarship at graduation every year for the school that I work for, so that the nurses get some money to help pay for their exam or their review class. And that's where this money has gone ever since the book has come out.
Yeah, and if there's no more questions, a couple of more messages from you ladies. One, what would you say precisely? And I was talking to Alessio about that. I was 24 years old when I arrived to this country, 25 when I found out that I was HIV positive, and now we're part of the first generations growing older with HIV. What kind of message would you send? Because again, especially it's for our HIV long-term survivors, what would you tell them? What would you say to us?
I would say, well, here's to all of my friends who are long-term survivors in their late 70s and 80s. This is not what's going to kill you. Something else. You're going to die with this, not from this. So that's the first thing. But also to thank you for hanging in there.
Yes.
And for people who, as I say, stepped up to try to find out how to fix it. And a lot of people did step up to try to fix this. You know, the doctors and nurses can't do it alone. We have to have volunteers. So they volunteered. And they volunteered, as I say, to mentor the younger people who were getting infected. So
I do want to.
I don't know. I would say thank you. So if it's one word, it's thank you.
I agree with
Yes,
thanking each other.
thank you.
I do want to thank each person that is here, because honestly, I had the honor to, I think I know most of them, and each of you guys are part of the puzzle. But this man will kill me if I don't mention at all mental health. He knows who he is. Well, just a few last thoughts about mental health and HIV and COVID-19.
Well, I think that in many ways, being a long-term survival is like being hammered every day with a new crisis. And so if people are experiencing things like PTSD, then that's nothing to laugh about. That's nothing to ignore. And I really think that mental health is becoming, thank God, something that people are recognizing as being a big crisis in the US right now. So take care of yourself. And I know it's really hard to try to even find a therapist these days, but get into therapy if you can, and recognize that you have been through a war, and that your mental health problems are a big result of being through this war. So, I want to just acknowledge it.
Yeah,
Yes, as do
like,
I.
acknowledging your power, guys. Catch, I mean, also survivors, but just nurses, again, as caregivers, as women, as part of the LGBTQ. And again, thank you to each one of you guys that is here, because I have the pleasure and the honor to know a little bit of many of you. So love you to death. And once again, a huge thanks to Ellen, Matzer and Valery Hughes. And I will put all the information again for their books, read them, and we're together in this, guys. And we have to keep the conversation going with all of you. Love you. It's not
Thank you.
else. Just enjoy your day, and we'll see you in the next conversation, because maybe
Yes.
there's gonna be a number 2 conversation with with Valery and Ellen. And thank you so much, you guys, for what you do.
Well, thank you so much for inviting us.
Thank you. Thank you
It
so
was
much.
Love you
my
you.
honor to be
guys.
here. Mhm.
My pleasure. My
Glad
pleasure.
I
For the
came on. Thank
recording.
you.
Thank
Have a
you.
great night, everybody.
Night.
Bye, guys.
Good